Welcome to the Lead at the Top of Your Game podcast, where we equipped you to more effectively lead your seat at any employer, business, or industry in which you choose to play. Each week, we help you sharpen your leadership acumen by cracking open the playbooks of dynamic leaders who are doing big things in their professional endeavors. And now your host, leadership tactics and organizational development expert, Karen Farrell Rhodes.
Welcome back to the podcast, and thanks for joining another episode designed to help you better lead at the top of your game. As you know, for Season 3, each month we're featuring leaders who have fascinating roles in a particular profession or industry. And today's episode is part of our special series featuring leaders in the healthcare industry. And now, enjoy the show. Hey there, superstars. This is Karen, and welcome back to another episode of the Lead at the Top of Your Game podcast. As you know, we are doing a special series on leaders in healthcare. And boy, do we have a fantastic guest for you today. I am so honored and pleased to introduce on today's show Dr. Lyle Berkowitz, who is the founder and CEO of KeyCare. And KeyCare is a virtual care company with a mission to create tech-empowered virtual care teams that support, strengthen, and amplify our nation's healthcare systems. Now, Lyle is a primary care physician himself. He's a health systems executive, a serial entrepreneur. He's an angel investor. And if there's anyone on this green earth that could speak to some of the dynamics going on in healthcare, he is definitely the premier expert, and we're honored to have him on today's show. So welcome to the episode, Lyle. We're so happy to have you.
Thanks, Karen. I appreciate the intro. I'll do my best to live up to it.
I'm sure you will and more, please. Well, healthcare is, on the top of everyone's minds. I don't think there's a news segment that ever goes that doesn't have it as a piece of their offerings of something new that's going on in the world of healthcare. But so there's tons to talk about. But before we start there, we'd love to learn just a tad about you personally. So for just as much as you feel comfortable, would you give us a sneak peek into your life outside of work?
Yeah, so I am a family man living in Chicago. Got 2 kids who are out of the house now, both in healthcare, which I love.
Oh, wow.
And I, like a lot of doctors, I love working and I love what I'm doing. I don't even feel like it's working. So I don't take a lot of breaks. But when I do love to travel. I like to get in a little golf if I can. I love to read some good historical, fiction, nonfiction, etc.
Nice.
But right now, I'm really obsessed with what I've most of my life has been around how do we fix and improve our healthcare system. And to me, it's just a big, giant game that I'm trying to put together. So it's a never-ending journey for me. And so it energizes me every day.
Oh, wow. Well, I can't wait to hear more, which we're going to talk about in a second. But I would be remiss if I didn't say that I'm similar to you. I love to travel and love to travel the world. So I think I've been to over 39 countries now, but I'm working on more. So I love to travel. And I think you'll be my husband's best friend because he's a golf fanatic as well. So
Awesome.
Okay, well, let's start off, Lyle, if you don't mind, by sharing a little bit about the company KeyCare, what you all are doing, and kind of peel back the layers of the onion a little bit and give us a sneak peek in how you all are trying to make a difference in the world of healthcare.
So as mentioned, we're a virtual healthcare company. So basically, you imagine, you've seen your doctors. Because of COVID, you've probably seen your doctors via video, online, etc. You may have even gone to one of these sites where you can see any doctor to help take care of you. It's a really convenient experience. It's something that for routine issues is extremely convenient for a lot of patients and people who don't have time to go in the doctor, don't want to go to the doctor and get exposed to other sick people, right? But the time element is critical in today's day and age. And so we wanted to build up a national primary care group that can help manage and take care of people fully online. However, the problem that we've seen over the years, and I've been a practicing doctor in an office. I've helped run a national telehealth company that sort of does transactional care. The problem has always been that when you see your doctor, that's good, but your doctor doesn't have that much time to see you online because they're busy in the office.
Right.
So if you see some other random doctor and they don't have all of your history, it's a very isolated experience, and it might be okay, but you lose out on quality and you lose out on the overall coordination of care. So I said, well, how can I do this in a way where I can have a panel of doctors take care of patients all over the nation and yet still be coordinated with their doctors in the health systems? So what we did was what no one else has done to date is we actually partnered with Epic, which is the big national electronic medical record system. Many people might know MyChart, which is their patient portal. But
My
60-70% of all health systems are using Epic. It's sort of
Yeah.
like Microsoft, the
Right.
operating system that runs many medical groups in healthcare. And we put our virtual care group, our instance of Epic, and that allows us to share data with any other organization using Epic. So we became part of the ecosystem. And so we actually partner with health systems across the nation. So they will send patients to us when they can't take care of them, where they're overflow 24/7 urgent care. We can take care of them in the context and coordination of who they are, knowing all their data, send that back to the health system. And we've expanded from urgent care to primary care, so chronic care, preventive care, wellness checks, etc. And at the very least, on one hand, we can be a team member to your doctor who's in the office, but you might not be able to get in easily, particularly for routine issues. On the
Now,
other
is
hand,
it transparent to the patient that you're different than, like, I'm a WellStar gal?
Mm.
Would I know? Because I have used the online doctor service before. Because to your point, sometimes you can't get to your doctor when you need to for in an urgent type of situation. Would I have known that it would be through your services, or is it WellStar would work with you and then they would just find a doctor that could access my history?
So it's a bit of a continuum. In general, you would go to Wellstar and you would say, I have an urgent care problem. And if your doctor wasn't available, our button, KeyCare, would show up in the Wellstar MyChart. You could click on it and connect to our doctors.
Ah, gotcha.
Wellstar would explain this is a partner of ours. In your mind, you're probably just clicking through and going, well, this is all
I don't
that
care if you're a
Wellstar's
partner or not. I just need some help.
You just need some help for a very routine issue.
Right.
You don't want to even bother your doctor. And the doctor that you saw would have all your information. So it would sort of be like seeing a partner, and it would feel very connected. So legally and technically, you would be told and see that this is another medical group. Wellstar would decide how they want to explain the partnership. But in your case, all you know is you went to your main clinic online, you went to Wellstar, and boom, you got to see someone who took care of you in coordination. So next time you saw your primary care doctor, he would have that information, and that you wouldn't have to say, oh, I went to some clinic up the street, or I went to some online thing, and they gave me some antibiotic, and I don't know what else they did. Now you can say, it's in your system. You can take a look.
Oh, nice.
And
Okay,
then
so on behalf of
separately,
all of America, we love you. This is
well,
wonderful.
yeah, I've seen it for years as a primary care doc. Like when our patients have so many times, they just want to get in for a quick issue. And a lot of times they don't even want to bother their primary care doctor for a routine issue. They want to know when they're really sick that they can see their doctor.
Correct.
But part of that is also relieving the primary care doctor, load balancing away the routine, easy stuff to a team that is really optimized for that. And then there's a whole bunch of other folks who don't even have a primary care doctor. Only probably maybe 25 to 50% of America has a true primary care doctor. You're lucky that you have one. Many people don't. They don't have the time, energy, ability to get in. They call up. It's a 3-6 month wait to get in to see anyone. They just don't bother with it. Or they feel fine, but they don't know they should get some type of checkup, get some screening. And what happens if they feel sick? Who and where do they go? Going to the ER is not the best option. So part of what we do is also are able to see these folks when they can't get in to see anybody, even for routine screening stuff. Doesn't have to actually be a new problem. So that's the type of stuff we're building up. We're also partnering with specialty care like behavioral health, rheumatology, etc., to make those types of doctors available as well, because we say that there's a shortage of physicians in this country. And indeed, the way we use them, we have a shortage because we use them to do everything. I actually suggest we don't really have a shortage of physicians. We have a shortage of using them efficiently. To give you some context analogy, it would be like saying that anytime you need to withdraw $100 from the bank, you have to go down to the bank and meet with the vice president of the bank and do a 15-minute visit with them to withdraw $100. We don't do that, right? But we used to 100 years ago.
Yeah, we
Maybe
did.
that's true. And then they got tellers to do that, and then they got an ATM machine, and now you can do everything online. But in healthcare, we make you go in and see the vice president of the bank to withdraw $100. So we haven't caught up in healthcare like we have in other industries. And even in healthcare, we've done a good job in surgery and certain imaging, et cetera, using technology and team-based care. But in primary care, we are old-fashioned. And we have plenty of doctors. If we start using technology, automation, and a team-based approach and doing more stuff online, we can make our doctors so much more efficient.
Wow. So I'm curious, KeyCare is not the only player in this field, correct? Are there others that are doing similar work to you? And if so, is there any collaboration amongst, because I'm sure they're having to have technologies talk to each other and workflows be similar. I'm just curious how you thrive. How does KeyCare thrive in a space if there are others that do this, has similar technologies as you?
Yeah. So we'll say there's a wave one. Over the past 10 to 20 years, there are a couple of companies, you've heard of Teladoc and Amwell,
Yeah.
et cetera, have done this. We'll put them in the category of what we'll call isolated, siloed, transactional telehealth. So they've been doing it for years, and they were way ahead of the curve. But sometimes ahead of the curve means you build up a lot of things and you lose out on what the standard is. So they're able to do that, but because they're doing it in a isolated way, the quality is not going to be as good as if they're coordinated. And what's happening is health systems, payers, employers are recognizing that isolated transactional telehealth care is not the ideal version. And so we're very different from them because we use the EMR, Epic, that is the traditional customary EMR used across most of America. It means that we're connected to all that data, but it also means we have a full functional EMR versus just a transactional tech system. So that's a big difference. And then strategically, we're really trying to take care of patients longitudinally, not just transactionally. And we're partnering with health systems. We're not competing with them. We're really saying, hey, we're here to help your doctors in the trenches to manage a larger population. With that said, there are a lot of specialty groups out there doing interesting niche things, but they're finding that if they're working on their proprietary technology, they can't easily connect to the health systems. And so when they partner with us, we're able to bring them in to the health systems in a much more seamless way. Again, another analogy would be you probably use Microsoft Word and Office.
Live and breathe it.
The reason is because everyone else uses it.
Right.
And if someone came to you and said, hey, I've got this brand new spell checker and you have to use a whole different system, a whole different word processing system to use it, you'd probably say, no, thanks. It doesn't make sense for me to pay for that. And I'm not going to pay to integrate it into Microsoft Word. And Microsoft isn't going to pay for it. They have a spell checker. So the issue is once you have a stable operating system, a platform, there are ways to build on top of that. And in our case, we build on top of it by bringing new doctors and providers onto our platform. But our platform is Epic. And we also can optimize Epic. I optimize and you optimize your Microsoft Word, right? You give it certain things, you tweak it certain ways. We can optimize our Epic instance to be more efficient and effective for virtual care. We can add in a little extra tech. We can add in content, etc. And so the analogy really holds true when you think about we don't need a new platform. We just need to make the current platform we're using as good as possible, knowing that it is the ubiquitous platform everyone else is using.
I love that. I do know I have a very close friend who is an Epic trainer and administrator for numerous hospital, you call those hospital entities, like a WellStar, if you will. And so she was in at the very beginning when all the hospitals and healthcare groups were adopting Epic, having to train up physicians and nurses and all that. So she was in that first wave. And now, like you said, it's the standard now. Everybody is using that. I'm curious, though, historically, healthcare wasn't an early adopter of new things and technology. And so, how have you found the healthcare system's attitudes now on innovating and taking advantage of a lot of the technology and work processes and things that are available now to create new efficiencies for the sake of the patient?
So health systems and healthcare folks are not necessarily the best innovators, right? There's
Yeah,
a standard.
that's what I read anyway.
Example that's often used is the classic 17 years for something to be published and researched and established before it's even spread. People get used to, they get muscle memory for what they're using.
Yeah.
And so in the late 90s, 2000s, as computers and internet were starting, you had a couple of early adopters, but it was really not until that mid 2005-ish area where meaningful use and government rules sort of financially supported use of electronic medical records. You saw that explosion, but there were hundreds and hundreds of EMR vendors, people trying lots of different things, and the government sort of funding it, so they were willing to financially try certain things. And they were probably much more willing to try one-off different types of software. I did a lecture in 2010 saying, now that the EMRs are becoming more stable, we need to think about them sort of like the iPhone. We need to build apps on top of them. I developed a company called Healthfinch that was built as an app that helped automate certain workflow, like refill processing for doctors.
Oh, wow.
But instead of doing it outside the EMR, we actually built it into the EMR. And that started to get accepted. And health systems were willing to work with lots of outside companies as long as they could integrate in some way with the EMR or sit alongside of it. That actually, we've seen, is going down. What they've seen is that a lot of these companies weren't able to keep up with the integrations, with the technology. And of course, the EMR companies started building stuff in. It's just like Microsoft. Again, the idea is that if you wait long enough, they'll start building it in. So Microsoft didn't have a spell checker to start with, but eventually they did. You didn't have to go and buy a new one. The same analogies happen. So today, probably harder to get into a health system with a new idea innovation because they're, one, they have a platform with Epic, or there are a couple of other EMRs. You've got some little Cerner, Allscripts, etc. But once they have that in place and that company continues to build on, Epic is, I think, releasing 10, 20, 50 AI tools. So you don't need to go outside to buy something new. You might as well buy something that's built in. Or in Epic's case, they have their own sort of what they call the showcase, but sort of like Epic's App Store or Apple's App Store.
Where you can
Epic
add.
has their App Store, and some of the other companies do as well. And so health systems are really looking at, how do I leverage the platform I have and either use what's coming from vendor and or something that has been closely integrated. It's very hard to bring stuff outside. And in fact, the real innovations probably are going to be in people and process, and business model innovation is probably more important in healthcare than technology innovation. Although we have seen, I think, probably the coolest thing in the past year has been ambient AI, which is an AI-based tool that listens to a doctor and patient talk and then creates a note. So it can be highly efficient, or at least effective, for the doctor to have a well-documented note without having to type everything themselves. And there are some companies who have done that.
Allowed? Is
EMR.
Does the doctor have to get permission from the patient to use the AI?
They'll often say, hey, we're going to do this, but it is built in. So because that AI, it is private, right? It is very secure.
Right.
It is not going elsewhere. It's not being saved elsewhere. It is sort of like having a transcriptionist sitting next to you and typing things up, but it's pretty cool because it doesn't translate it verbatim. It actually creates what a good note should look like. So it would take out, if I asked about, hey, did you see the Cubs win last week?
Right.
It wouldn't include that. It would only include things that are medically relevant, and the doctor, of course, has to sign off on it at the end. But today, I would say healthcare, large health systems, right? If you're going to do something, start small. think innovation, use user-centered design, figure out what corporate metric and KPI you're going to really fix. And I always say, because I've done this a long time, is you're better off being inside the balloon and expanding it slowly than throwing darts at the balloon trying to radically change. Healthcare does not like to radically change, but yeah, you can boil that frog in water, slowly moving where we are in some ways. I think about ourselves. We're working with health systems. We're using Epic. We're billing fee for service. What's innovative about that? Well, what's innovative in our case is we're doing it virtually, and we're going to continue to tech enable our virtual care doctors, because everything's done online. We can tech enable that a lot more than an office visit.
Yeah.
And over time, I'm hoping that we'll also see a true team-based approach to managing a population. I'm also hoping that we'll see things like physician compensation redesign. Health systems start paying doctors based on the panel size they manage and the quality that they manage, not on how many patients they can see in the office.
I love that.
Because if we don't change compensation for how we pay doctors, we're only going to get what we pay for, which is lots of volume.
They're not going to be incentivized to do anything different,
Yeah. So I would say the short answer to your question is make sure you're really aligned with metrics, figure out, and including what the hospital wants and how they're paying doctors. And as much as possible, use the technology that they already have in place and figure out how to, people, process, and maybe little tweaks technically to get to your innovation.
Wow. I have a million questions, and I wish I had you 5 hours. Let me ask you this. So for KeyCare, what is your business model? How do you all get paid? Is it a percentage of everyone who books, or is there another financial model?
Well, in many ways, we are like a big medical group. We get paid to see patients. The majority of our revenue is coming from taking care of patients and getting paid either by the insurance company or by sponsorship. If, for example, a health system or employer may pay for their employees, but that is the majority. We do have some maintenance agreements with hospitals, but it's a small part of the total revenue. So we are in that way similar to any other health system out there. We are, again, in many ways, like a big medical group that uses Epic. And every medical group out there gets paid by seeing patients or taking on risk to manage patients.
Are you taking away from the primary care because they're not seeing as many patients as you all are?
Well, that's one of their concerns, right? So we have to be really careful about going in and saying, hey, we're just going to take all your patients or all your easy patients,
Sure.
and you're going to see less, particularly if you're paying your doctors based on their volumes.
Right.
So a couple of things there. Number one is the first thing we do is simply say, look, we're just seeing the patients you can't. We won't start seeing patients until you're full. And the truth is most primary care doctors are booked out 1-2 months.
Oh,
so
or more.
We're not stealing their patients. Number two, we're actually keeping their patients in the system, because when they can't see their patients are going to go to the urgent care down the block, go somewhere else online.
Correct.
And if they have a good experience there, they're going to steal them. We will never steal them. We're sending them right back because we are coordinated and connected to the health system. And third, as we hopefully move into true population health and paying doctors based on panel size management, imagine if I go to a doctor and say, hey, I've got a virtual care team, and together we can start taking care of more patients. But instead of you seeing 25 patients a day in the office, we're going to cut you down to 12 patients. But you're going to increase your salary by 30%. How does that sound? And most doctors are going to be like, well, that sounds too good to be true.
Yeah.
And you'd say, because we're making, to think about your whole podcast, what you talk about, we're making you the leaders. We're putting you at the top of the pyramid, doctor. Instead of you having to do everything, instead of you having to take care of every part of the patient, you are not the VP of the bank, should not be taking care of everything.
Right.
You're going to see 12 patients a day who really need to see you. And you're going to have plenty of time with those patients. They are more complex and they need you. Those other bunch of patients, though, who have routine issues, they don't need you today. But they'll need your team, and your team's going to work in coordination with you. So imagine if we can double your panel size. A typical primary care doctor can manage 2,000-ish patients. What if we could say you can manage 4,000 or 5,000 patients because your team is going to take care of all the routine stuff and you're going to focus on the complex stuff that you as a doctor in the office should be focusing on.
Right.
And because your team manages more and we pay you by panel size and quality, we can pay you more. We have burnout because we keep asking doctors to see more and more patients and we keep reducing their salary. No doctor is trying to squeeze in another extra patient because they want to make a little more money. It is a very, very tough intellectual challenge. Think about if your day was 20, 25 meetings every day. Each meeting was 15 minutes, no matter how complex the issue. And each one, someone came to you with at least one, but up to 5 problems. And you had to document everything about every problem, solve every problem, explain it to this person, write everything out, type it all out for them, give it to them, and you have 15 minutes, and one after the other. That's what we've done to doctors. That is not how you use your highest and best. And most of the care that's done is what I call the triple R threat: routine, repeatable, rules-based care. We don't need a doctor to refill standard medicines, to order standard labs, to do general wellness checks. We certainly don't need a doctor in the office. A physician and NP, quite honestly, using computer technology, automation, can do much of that.
So does anyone ever say no to you? I'm sold. I mean, you're the best salesperson. You have the right justifications. That pitch was awesome. I need to put you on Shark Tank. Does anyone say no? Why would they say no? What's the downside? What is it I'm not seeing?
So, people are different. So from the patient perspective, we and others have done numerous surveys. And what we find is about a third of the patients actually prefer doing everything online for routine care. About a third say, I'm fine with either, whichever one's more convenient, probably online. But about a third of people say, I really like going to the doctor's office. They have a good relationship. They want to go in. So not every patient always wants to do stuff online. And some are reticent about seeing someone that's not their doctor. Now, with that said, unless you have a concierge doctor, there's no guarantee you're going to get in and see your doctor.
Yeah.
But majority of patients, particularly post-COVID, have learned that this is a very good way to take care of things. And many patients, again, recognize the difference between a small routine issue where anyone can take care of them, but they want it connected to the doctor, versus a really complex issue where I want to see my doctor. But overall, patients really love virtual care, and we're not giving them enough options.
Wow.
On the other hand, doctors who are paid solely to see patients in the office, that's their salary, they are not going to willingly, send too many patients to us. That our biggest problem right now is incentive misalignment. And so we do encourage health systems, think about how you're paying your doctors and whether this makes sense. Some health systems will say only our doctors in our offices should see all patients. I think that's short-sighted. I think more and more of them are recognizing that the more that we can offer options to our patients, but keep them in the system, the better. We've done pretty well. We've signed up 17 health systems in a little over a year and a half.
Oh, that is amazing.
Signing up health systems is a hard thing. It often takes a year or two to do it.
Yeah.
We've signed 7 in that time frame, and we have 9 more in contracting. So we actually have established product market fit. Health systems like us. However, how much they'll share the care with us and our providers is going to be a combination of, are we taking the insurance that they offer patients? Who's paying for it? Needs to be affordability, awareness. We still have some humps to cross, but we are seeing this starting to happen. Pre-COVID, health systems really did not want to do much of this. Post-COVID, they've gone from a small amount of visits to over on Epic's system, over 4 million visits a month are done on video, and that continues to rise. And so we think this is now part and parcel, just part of healthcare. And the issue is, do you want and need a partner to help you with it? Our job is to be an amazing partner and to be able to do it quicker, cheaper, and faster, better than a health system can do it themselves. Because I want my health system focusing on curing cancer, broken bones, heart attacks, and complex patients. I don't need my health system spending a lot of their time and money on assigning their doctors to take care of sinus infections and UTIs or routine refills. I want their doctors to focus on the hardest stuff, but that means they need a partner to focus on doing the routine stuff really efficiently.
Amazing. I am just speechless of the opportunity. And I do think it's very well needed because, especially depending upon what part of the country you're in, if you're speaking to the US, but just specifically, it's hard to get into, a doctor. And I'm lucky to have a great primary care, but I'm a power user of technology. And so to your point, I'm in that bucket that for certain things I want to see my primary, but others, the sniffles or something, something I can't handle as much. I'm okay with seeing someone else if I don't think it's like urgent or something that I know that they can help me and help me faster than it would
Mhm.
take for the 3-month wait, to get
We
into my
asked,
primary.
we asked, does it matter if the random doctor you see it has access to your information and
No,
connection to
it
your
doesn't matter
doctor?
to me at all.
It may not, but a lot of people it matters to, because things like, do they know your allergies? Do you have to refill everything? Put everything back in.
Yeah,
Do they know who you are? Have they connected to your doctor? Yeah, and to a lot of patients, they don't. They're like, I don't care, but
I
it
know.
matters as a
If you
doctor. I'm
have that
telling you,
expertise and
gotta
you can,
be.
that's all I
You have to
care
be
about.
careful who you're seeing.
Oh, that's amazing. Well, you all are doing some great work at KeyCare. I know you're going to be continuing to expand based on what you're offering. And if you give that same pitch to how you explain it to me, I don't know how anyone could say no. We don't want to partner with you all because you're providing such an invaluable service. Now, I literally, that's why I said I wish we had 5 hours. I literally blinked and we're coming up on time. But, one of the things that we do, we can never let our guests go until you weigh in on our signature question. As you know, I wrote a book and did research on leadership execution, some of the tactics and things that highly successful leaders use in any leadership effort. All 7 are equally as important. You just use different levers at different times based on the effort that you're doing. And so you were so kind enough to share that leading with intellectual horsepower resonated with you. And for you listeners out there who haven't gotten the book yet and read it or looked at our white paper, leading with intellectual horsepower is all about using your areas of expertise to watch trends, to peek around corners and see, and identify things that others miss and bring it to the attention so you can take action upon it. And so now hearing the story of KeyCare, I kind of understand a little bit about why you might have selected that one. But curious minds wants to know, Dr. Lyle, why did leading with intellectual horsepower really resonate with you?
Well, first of all, just a shout out to your book and your theories. Right, it was very hard because you have multiple things that are all really important. You had to
Yeah.
choose one. And I'm like, I'm choosing intellectual horsepower. That sounds like I'm such an egotist that I've got, you
No,
know,
no.
I think I'm just smarter than everyone else. The reason it resonated with me, because as you described it, is because I'm a bit of a weird hybrid, right? I am an engineer by background who became a doctor, who became a health system executive, who became an innovator and formally trained in innovation, who became a digital health entrepreneur, who was at an academic medical center for 20 years, taking care of patients and working in the system, who went and worked in a big national telehealth company and learned operations there. And none of that would have mattered except for COVID coming. And all of a sudden, the perfect storm came because on top of that, right, all of a sudden people wanted virtual care. And my expertise just literally coincided with what the world needed. And my background as a doctor who knows technology and innovative things all of a sudden came. And on top of that, I happen to know a lot about Epic because I helped implement that at Northwestern for primary care. I built a company that integrated with Epic. So all of these things had to come together for us to be able to come and say, let's create KeyCare. Yeah, I'm not. I think in general, doctors aren't regarded as the best CEOs of companies. This is probably the only company I should be allowed to run, right? Right, but to have the ability to see from my perch,
Yeah.
understand the technology and understand how Epic works, understand how the health system works in general, because I used to teach courses on that, understand as a doctor how primary care works, understand how the national telehealth vendors work,
Yeah.
bring all that together to create this new version, this wave 2, telehealth 2.0. That's why that intellectual horsepower appealed to me, because it's not about necessarily being smarter than everyone else, but I have insight into all the different things that literally all came together to make this company that
Look.
creates uniqueness that I think is different. Because if you look at most telehealth companies, it's started by some kid, or maybe a doctor who doesn't know tech or et cetera. But,
Yeah.
I get to bring it all together. And I'm not a 25-year-old kid, but they're two peaks to entrepreneurs.
Yeah.
One is before children. The second is after children. Now my child. And this is where I get to spend a lot of my time.
I love it. Well, I will say I know just a tad about a tad. I worked for 4 years for Blue Cross Blue Shield of Florida. Back in the day, it was way before telehealth and technology. That's when the HMOs were huge at the time, and they had call centers back then of nurses, believe it or not.
They still do.
Huh?
They still
do.
have.
I've been out of it for a minute, but I appreciate, all that, the advancements that are being made. I look forward to seeing how healthcare will continuously innovate. I'm hoping they have the bug now so that we can provide better care and more extensive care to patients of all financial abilities, I will say. I don't know what the right answers are, but there are a lot of underserved around as well. So I think as much as leaders like you can focus on bringing great opportunities and efficiencies to healthcare, I think it will impact other areas and innovation will continue to happen. But that's just Karen's thinking and wish list and my dreams.
Well, it's certainly part of what is now called the quintuple aim, right? How do we improve quality and improve service, decrease costs, expand access, and access to the underserved population, right? Everyone says, you can either, you can improve quality, cost or access, but you can't do all three. I'm going to suggest we can.
Yeah.
With, again, a tech-empowered virtual care workforce working in, as a teammate to the health systems, I believe that there is a way to say, by improving access, we immediately improve quality. And if we can do it in a way that makes financial sense for everybody, because we can take care of people earlier before they're too sick, but identify the ones who need more help, we are able to start taking care of bigger and bigger population with a smaller group of people.
I love that. Well, Dr. Lyle Berkowitz, it has been an absolute honor having you on the show. We're going to have a lot of information about your bio and background and links for you and your company in our show notes, but I'd love to give our guests opportunity to give voice to that on the podcast. So where can our listeners find out more about you and KeyCare?
Well, our website's keycare.org. Again, we're not really direct to consumer, but if you're at a health system and want to find out how to get a virtual care partner, come find us. We've got, LinkedIn. I have a website, drlyle, drlyle.com, and I'm on Twitter, Dr. Lyle MD. I'm out there a lot, LinkedIn, et cetera, to put out my views on how I think healthcare needs to continue to transform, and who's doing great stuff, who's doing stuff that might not, be as important or great for the health system. So I'm pretty much an open book on that. And I love being able to talk to you about this. It's been a fun conversation.
It has been. I know I've learned a lot, and I'm glad to have you as part of our Lead at the Top of Your Game network. We'll definitely be following you and your thoughts and seeing how things transpire. But we do appreciate the gift of your time and coming on the show. Thank you so much.
Of course.
And thank you to listeners for the gift of your time as well. We know there are literally millions of other podcasts you can be listening to, so we don't take your patronage lightly. Please be sure to like and subscribe to the podcast and just share with just one friend, because by doing so, we can all learn how to better lead at the top of our game. Thank you so much, and see you next week. And that's our show for today. Thank you for listening to the Lead at the Top of Your Game podcast, where we help you lead your seat at any employer, business, or industry in which you choose to play. You can check out the show notes, additional episodes, bonus resources, and also submit guest recommendations on our website at leadyourgamepodcast.com. You can follow me on Twitter, Facebook, Instagram, and LinkedIn by searching for the name Karen Rhodes, with Karen being spelled Karan. And if you like the show, The greatest gift you can give would be to subscribe and leave a rating on your podcast platform of choice. This podcast has been a production of Shockingly Different Leadership, a global consultancy which helps organizations execute their people, talent development, and organizational effectiveness initiatives on an on-demand project or contract basis. Huge thanks to our production and editing team for a job well done. Goodbye for now.